Welcome back, students. We are now on chapter 4 and it is week 3. This is now going to be just about the diagnostic coding. So this is really your intro to the ICD-10 CM or diagnostic coding. It has its own set of official conventions and they're actually a little bit harder than procedural. So I want you to pay close attention to this chapter. I want you to read everything that you can in addition to the PowerPoint. So take advantage also of the coding bites. That's on page 56. And keep a small medical, this tells you to keep a small medical abbreviation dictionary. I don't know about you, but abbreviations and acronyms, we have a lot of them to begin with, but the medical field has even more. And it takes a while to learn them, so don't beat yourself up over it. It's okay. Become familiar then with all of the official guidelines for coding and reporting. And you will have an opportunity this week also to do a matching exercise in addition to viewing the PowerPoint, which you usually will have, but I'm just going to say pay close attention to that too. Feel free to take it more than once to make sure that you get all of them correct. And also feel free to look at the PowerPoint and just view the slides, but also do the video one and pay attention to that. The more, the better in this case. So remember that in order to choose the correct diagnosis, the code or codes that we're going to need, you must look at the whole story about why the physician, provided the services and the treatment and the procedures. So see page 65, and there's an example there under the how many codes do you need. Take note of the word recurrent. Also note the cause. And were you tempted at first to just diagnose perhaps acute sinusitis for that particular patient when you look at it? Without all the codes, you don't have the whole story. And it's really important to make sure that you don't forget to code something. So the alphabetic index is going to suggest a possible diagnostic code, but don't ever stop there. This is the beginning of your coding. It is never the finishing point. It is never just look it up and use that code. So start there with the alphabetic index. It'll suggest a possible code, and then you must go to the tabular list. This is mandatory. The tabular list is going to give you much more detail in the description, and it's going to give you the codes and the notations and the guidelines, and it's going to help you to get to the bottom of the actual code. So remember always to answer the following question. Why did the healthcare provider care for and treat this particular individual during this particular encounter? You are not looking for the entire history once again, just this encounter. So sometimes screening other preventative services have no signs or symptoms or diagnosis of a condition. For instance, if a patient comes in annually for a physical exam, they may be perfectly healthy when they come in for that exam. So in this case, I want you to look at page 87 and how those are handled. You will not necessarily have a diagnostic code that addresses a condition. It might just address what they came in for. So now it's time for you to view the PowerPoints, and the great news once again is you can do this in several formats, and you can view them, you can listen to them, whatever your preference is. So see you in lab soon.